Hey guys, welcome back to my channel. I'm so excited to have you all. Today is tricks and hacks for all dental nurses, and I'm so excited to share with you all of my little inspirations for you all to take back with you for working in clinic, just to make your lives a little bit easier, but also to share with you how to get your freebies. Okay, so my first little trick and hack is to do with suctioning. So whenever I've had a trainee nurse come in and first start, I always indicate to them that suctioning at the back of the mouth is probably the best place to position the suction. And whether you agree with that or not, I've always found it quite good, especially for the patient. The water gets completely taken away at the back of the mouth. I always kind of suggest maybe positioning it at the second molar. It does prevent any type of water kind of clogging up at the back, and we don't want the patients to kind of choke or drown on the water. So my little trick is keep it on that second molar, whether you're working on the anteriors or at the front of the mouth. It does spray up, but you're stopping the water from loading at the back of the mouth, which causes problems to the patient. So make sure you keep your suction right at the back of the mouth. It does work, and I have always suggested it to any new nurses that are training. Okay, so this second one you might already do anyway, but it is a quick reminder to always pack spare uniform. If you're working on reception that day and someone phones in sick or goes home sick early and you don't have your spare nurse's uniform, you're in a bit of a pickle because you can't nurse. So always keep a spare in your locker at work. It's just handy, and I think keeping a spare pair anyway, just in case you get bleach or any materials down your uniform, you don't want to look scruffy or anything in front of the patient. So make sure you always keep your spare uniform, and I always keep spare socks too. The spare socks are actually for coldness because I get really cold feet, and it's actually occurred to me one time, it was so cold, and even now with COVID and everything going on, we always have to keep the windows open, so my feet are always freezing, so I always double pair my socks. I don't know if anyone else does that, but I do. Now this is another one for trainee nurses. I always suggest that a trainee nurse should take in a little booklet with them on their first week to second week of training. It is so overwhelming when you first walk into a surgery and you have no idea what anything is. It's actually quite scary, and you look at all these instruments and you're thinking, what is that? Why is it going in the patient's mouth? And you're a bit baffled, and I completely get that. I worked within 3 days on my own in surgery, and I was petrified when I first started. So I've learned from my mistake, and I think it's really good to keep a booklet on you, keep a little pen, and always take water. Keep hydrated. It can be very draining. So make sure you keep your little booklet, and it can be like a really small one, and you can scribble in it, write in it, do any little doodles that you need to, but it does work for you to reflect on once you go back into surgery. So if any of you has seen the meme, which is going around all the time, when you're putting your gloves on, do you struggle to actually get them on? As a nurse now, and as I've been nursing for nearly 5 years, I just do it every day, and it's my normal routine of I always wear gloves, so I'm used to putting them on. But when you're first time nurse, getting those gloves on is so hard. I struggled a lot. I didn't know what to do. I could get these gloves on, and you always have to change them, so changing into a new pair of gloves was a real anxiety attack for me. So I actually googled this little trick, and it says always stretch your gloves before you put them on. Stretching them allows you to just easily slip them on, and you can carry on with what you're doing. As dental nurses, our gloves are changed 24/7. I am going through gloves like there's no tomorrow, so stretching them, blowing in them, it helps. Anything to get the glove on, works. And I know the little meme says on Facebook or Instagram or wherever, when the dentist is watching you or the doctor and you cannot get this glove on, and it's just really embarrassing. So this is a little trick for you to not get embarrassed in front of your clinician when you're putting your gloves on. This next one is for Invisalign patients. So Chewies, we often give these out during a treatment and during the time people have got their Invisalign trays on. Chewies are really important to have when you are doing an Invisalign treatment. But when you run out of them, it is such a struggle because patients really like using them. And when you run out in practice because you haven't stocked up on them for some, I don't know, reason, we have decided to come up with a trick. So if you have saliva ejectors in your practice, they are so good to use as Chewies. All you have to do is cut them up into about that big, and then take the metal out of the suction and just pull them out with with pliers or something, and the patient can use those as temporary use until we get the orders in. But they are so good to use if you have run out of Chewies in the practice. I've been so excited to tell you this last little hack that I have found out. If you are a registered nurse, which I know some of you have literally just become, you can sign up to Colgate, Philips or any other dental material stations, Oral-B, anything, and you can register with them to get your monthly freebies. And this is so cool and I love it. I think it's great. You get pretty much a life supply of toothbrushes. I mean, who wouldn't want that? Us dental nurses, toothpaste is literally the bomb. So get signing up as soon as you can. It will ask for your GDC registered number, so make sure you have that with you. But other than that, enjoy and I want to see all of these freebies on your Instagram pages. Okay guys, that's the end of my little tricks and hacks video part 1. I will be doing part 2 at some point, but I'm just glad I got to share some little hacks with you today to take away and use in clinic with you. So my next YouTube video is quite a cool and exciting one, which I've never ever done before, and it is a collaboration with Dr. Woof Apparel, so I'm quite excited to share with you what I'm getting up to with them. But also I'll be working with another dental nurse who I've been in contact with for quite a while now, and I'm just so amazed at her progress, and we get along so well. That we will be doing a collaboration soon too. So keep your eyes peeled, and I'll let you all know what's going on. But until then, thank you so much for watching guys. Keep an eye out for my second video. It will be out very soon, but also I'll be releasing my collaboration with Dr. Woof too. Thank you so much, and I'll speak to you all very soon. Hit the like, subscribe and little bell to keep in touch with my page, and I'll be seeing you all very soon.